You know, one of the principles that we talk a lot about in the placements that we run with Aboriginal and Torres Strait Islander people is that it's really important to be client-centred, to understand the client's context. There's enormous diversity amongst Aboriginal and Torres Strait Islander people, so you can't expect that the first person that you meet and talk with and work with as a therapist or as a student is going to have the same context as somebody else. So, you know, there might be some people that you work with, some families that you work with who, you know, are from middle class families and, might be similar to my background, but then there's going to be other families that I might work with who, you know, come from families that, you know, have really struggled with poverty or have other socio-economic difficulties, or there are other social determinants of health at play. And I think that understanding of the social determinants of health is really key to working in this area, that we need to understand that whole context of somebody's life, not just that, you know, they're the person sitting in front of us with the broken hip or whatever it is, that, you know, they come with a context, with a family, and with a whole bunch of other skills and knowledge, and we need to be able to understand that in order to get the best outcomes. And that's really our job as a therapist or as a student working in this area, is to understand that context and knowing what is going on with that family or with that individual. And there's a bunch of different ways that we can do that. I think one of the most important things is about developing a relationship with our clients and taking the time to do that. And sometimes that might take a bit longer to develop trust because of the history that we've had in Australia, particularly with non-Indigenous health providers and Aboriginal and Torres Strait Islander people. So it might just take a bit longer to build that relationship, but it's, in terms of getting the outcomes that you want, it's really, really critical that we do that. And I think the other thing that we don't mean to do as therapists or as students, but we often get, particularly students, get bombarded with knowledge at uni about, you know, the sort of statistics around Aboriginal and Torres Strait Islander people. So, you know, we know that there are poor health outcomes and poor education outcomes and poor employment outcomes. And we don't mean to, but we can sort of make this subtle shift subconsciously. To therefore, you know, when we hear about, you know, an Aboriginal Torres Strait Islander client, we think about the deficits and we think about the problems, and we don't think about the strengths and the resiliences. And just like we would with any other client, you know, in occupational therapy, we're taught to see the child or the person with the disability, not the disabled person. And it's the same kind of principle, that we need to see the client who's in front of us, who comes with strengths and resiliences and skills and abilities and knowledge, and it's an opportunity for us to build on those things and to tap into those things, rather than thinking that we're coming from this platform of, you know, deficit and dysfunction all the time. And I think that's probably a key shift that I think our students make when they're on placement with us, is really moving from that. You know, it's often a well-meaning thing. It's a there, you know, I want to help sort of thing, but it often often students come with this platform of, you know, all the need and the problems. And yes, there are needs, and yes, there are, you know, challenges, but there's also a lot of resilience and a lot of things we can learn as students and as practitioners that will then help us to be better at what we do through our interactions with Aboriginal and Torres Strait Islander clients. So in terms of understanding that context, there's some practical things we can do. So we've talked a bit about building relationships. We can also build really good relationships with Aboriginal and Torres Strait Islander people in the environment around us. So if you're lucky enough to be working in an Aboriginal and Torres Strait Islander context, then there should be a good number of people around that you can draw on their knowledge and expertise. But if you're working in a hospital or a community health centre, it might be that you get to know the liaison officer. Or it might be that if the client comes in with another family member, you build a relationship with that family member as well. And that also helps you understand that context and understand what other supports are in place with that person. Often it's not uncommon for Aboriginal and Torres Strait Islander people to have many services involved in them, but for none of those services to know who else is involved. So it's really important to find out, you know, what other help is out there for that client, what other things are going on, and how can we help them navigate the system as well, because we all know that the health system can be a bit tricky to navigate sometimes. So that's a really important aspect of what we do as well, is understanding what other kinds of support services are in place. And then also, you know, spending time out in the community, going to things like NAIDOC events, going to community days, gives you an opportunity to have a look at that client in a completely different context, to understand, you know, how Aboriginal and Torres Strait Islander people work together, how communities work together, so that we can get a better understanding of how all those bits of the puzzle kind of fit together. And then asking good questions, you know, not making assumptions, and maybe even asking those questions in different ways as well. Sometimes it might be, you know, asking a question and then coming back around to that question a little bit later and asking it in a slightly different way, or checking in with the information, because sometimes it takes a few goes in order to be able to get that complete picture, just as it would with lots of different other clients as well.